Hi. Welcome to the Professional Certifications channel. In this video, we will explore common questions asked by JCI surveyors and provide answers on the patient and family rights, PFR.
Tell me how the hospital addressed the patient religious and spiritual needs.
Addressing the religious and spiritual needs of patients is an essential aspect of holistic healthcare, recognizing that spiritual well-being can significantly impact a patient's overall health and recovery. Hospitals typically address these needs through various policies, services, and practices designed to respect and support patients' diverse beliefs and practices. Here's how hospitals generally approach this. 1. Spiritual care services. Chaplaincy Services. Many hospitals have chaplains or spiritual care providers who are trained to offer support to patients and their families, regardless of religious affiliation. Chaplains provide counseling, prayer, and rituals that align with the patient's faith tradition. Chaplains are available to listen to patients' concerns, provide emotional support, and help them find meaning and comfort during their hospital stay. Access to religious leaders. Hospitals may facilitate visits from the patient's own religious leaders or clergy. If a patient requests a visit from a specific religious leader, the hospital staff can often assist in making these arrangements. Some hospitals maintain a list of local clergy from various religious traditions who can be called upon to visit patients. 2. Respect for religious practices and beliefs. Accommodation of religious practices. Hospitals strive to accommodate religious practices, such as prayer times, dietary restrictions, and the observance of religious holidays. For example, providing space for prayer or meditation, such as a chapel or designated quiet room. Ensuring that meal options meet dietary restrictions based on religious beliefs, such as halal, kosher, or vegetarian meals. Allowing religious rituals, such as the administration of sacraments, blessings, or other religious rites, as long as they do not interfere with medical care. Cultural competence training. Hospital staff are often trained in cultural competence, including sensitivity to the religious and spiritual needs of patients. This training helps staff understand and respect diverse beliefs and practices and ensures that care is delivered in a culturally and spiritually sensitive manner. 3. End-of-life care and decision-making. Incorporation of religious beliefs in care plans. Patients and families are encouraged to express their religious beliefs and preferences, especially in end-of-life care. Hospitals typically respect these beliefs when developing care plans, including decisions about life-sustaining treatments, palliative care, and advanced directives. Staff may consult with chaplains, ethicists, or the patient's religious leaders to ensure that the care provided aligns with the patient's spiritual beliefs. Rituals and last rites. Hospitals generally accommodate requests for religious rituals at the end of life, such as last rites, anointing of the sick, or other ceremonies that provide comfort to the patient and their family. 4. Multifaith resources and facilities. Multifaith chapels. Many hospitals provide multi-faith chapels or prayer rooms that are open to patients, families, and staff. These spaces are designed to be inclusive and welcoming to people of all religious backgrounds, providing a quiet place for prayer, meditation, or reflection. Religious texts and materials. Hospitals may offer religious texts, e.g., Bibles, Qurans, Torahs, and other spiritual materials for patients to use during their stay. These materials are usually available through the chaplaincy service or the hospital library. 5. Communication and documentation. Assessment of spiritual needs. Upon admission, patients are often asked about their religious or spiritual preferences as part of the intake process. This information is documented in the patient's medical record so that healthcare providers are aware of and can accommodate these needs throughout the patient's stay. Ongoing assessments may be conducted by chaplains or other healthcare providers to address any emerging spiritual concerns during the course of treatment. Respectful communication. Healthcare providers are encouraged to communicate with patients about their spiritual needs in a respectful and non-intrusive manner. This involves listening actively, showing empathy, and being open to discussing spiritual matters if the patient desires. 6. Support for staff. Staff training and support. Hospitals may provide training and resources for staff to help them recognize and respond to the spiritual needs of patients. This includes understanding how to make appropriate referrals to chaplains or other spiritual care providers. Hospitals may also offer spiritual care and support to staff members, recognizing that caring for patients with serious illnesses can be emotionally challenging. 7. Policy and ethics committees. Ethics consultations. Hospitals often have ethics committees that include chaplains or spiritual care providers. These committees can help address complex cases where religious beliefs impact medical decision-making, ensuring that ethical considerations are balanced with respect for the patient's spiritual needs. Patient rights policies. Hospital policies typically include provisions that protect the patient's right to practice their religion and receive spiritual care. These policies are aligned with broader patient rights, such as the right to respectful and individualized care. Example scenario. A Muslim patient, Ahmed, is admitted to the hospital for surgery. Spiritual needs assessment. During the admission process, Ahmed informs the nurse that he prays 5 times a day and requires halal meals. Accommodations. The nurse arranges for Ahmed's meals to be prepared according to halal guidelines and informs the kitchen staff. Ahmed is shown to the hospital's multi-faith prayer room, which he can use for his daily prayers. The room is equipped with prayer mats and a compass indicating the direction of Mecca. The nurse contacts the hospital chaplain, who is familiar with Islamic practices, to visit Ahmed and offer spiritual support. End-of-life consideration. Ahmed discusses his preference for religious end-of-life practices with the chaplain, who documents this in his medical record. The chaplain also notes that Ahmed's family should be contacted to ensure they can perform any necessary religious rites if needed. Conclusion. By providing such comprehensive support, hospitals can ensure that patients' religious and spiritual needs are respected and met, contributing to their overall well-being and satisfaction with their care.